Hi, my name is Corbin May, and I'm going to begin my physical assessment of my patient by assessing her face first. I'm observing the patient's face, and I notice no lesions, no moles, no scarring, no outbreaks. And I'm also observing the patient's facial expression, which is calm and appropriate for the situation. Her face also seems to exhibit symmetry. I'm going to come around and inspect my patient's scalp, making sure that there's no bald spots and that the hair is evenly distributed, which it is. And I'm also palpating for my patient's cranial skulls. And I feel no indentions or no cracks or no soft spots. Let's see. I'm going to come around and assess my patient's temporal arteries. Both are present and normal feeling and also equal. And next I'm going to assess my patient's temporal mandibular joints. Could you open your mouth and close it? I feel no clicking and popping with the opening and closing. Do you feel any pain associated?
No.
I'm going to test the fifth cranial nerve by asking my patient to clench her teeth and hold resistance. She's able to do so properly. And I'm also going to ask my patient to close her eyes and tell me when you feel me touching your face.
I feel it. Feel it. Feel it.
Okay. Open her eyes. I'm also going to test the seventh cranial nerve by asking my patient to make a few facial expressions. Can you raise your eyebrows, close your eyes tightly, show your teeth, puff out your cheeks, smile, and frown. I will now assess my patient's eyes, beginning with her vision. Please cover your right eye and read the lowest line that you can on the chart.
PEZOLCFTD.
Please cover your left eye and read the lowest line on the chart that you can.
PEZOLCFTD.
The patient is able to read the 10-foot line 10 feet away from the chart. Now to assess cranial nerves 3, 4, and 6, I will assess my patient's pupils. The patient's pupils are both reactive to light and equal in size at about 3 millimeters, and I see regular movements in both. To test cranial nerve 3, I will test the patient's visual accommodation. Focus on the point in front of you. Now focus at the wall over there. The patient's pupils dilated slightly whenever looking off into the distance and moved outward, and they also moved in slightly and constricted whenever she was looking at the point closer to her. To examine her external eye, I see no abnormalities with her eyebrows. Her eyelids are not swollen or puffy. Eyelashes seem uniform, and I see no drainage or lesions upon the eyeballs. To assess her internal eye structures, her conjunctiva seem normal and clear. No abnormalities with the cornea. The sclera is white and the iris is light brown. I will also assess my patient's 6 points of vision. Please follow my finger. The patient is able to follow my finger with uniform movements of both eyes and no abnormal movements. To inspect the ears, I will look at the patient's ears externally. Both seem symmetrical and even. No lesions noted upon them. No heavy drainage noted. And I will also do the whisper test. I will whisper something into the patient's ear and ask her to repeat it.
Apple.
Orange.
Orange.
Moving on to the patient's nose, I see no heavy drainage or any abnormalities. I will now assess the patient's patency of each nair. Sniff. Sniff. Any difficulty with either one?
No.
I will now palpate the patient's maxillary and frontal sinuses. Do you feel any pain or tenderness with either one?
No.
Moving on to the patient's mouth, I will get her to open her mouth and stick out her tongue. Okay. I will now use the pen light to assess the patient's mouth. Everything seems to be looking normal. The oral mucosa and gums are both pink. Teeth are all present with no signs of plaques or cavities. The roof of the mouth is pink. No lesions noted. Under the tongue is also pink with no abscesses or any abnormalities. Stick out your tongue a little further. Uvula is present and pharynx is pink with no signs of striations or anything. Say ah.
Ah.
You will use moves appropriately. And the patient's gag reflex is present. To begin the assessment of my patient's neck, I will begin by palpating the lymph nodes, asking for any kind of tenderness. Starting with the preauricular, the posterior auricular, the occipital, coming back around to the tonsillar, the submental, the submandibular, the superficial cervical, the deep cervical, the posterior cervical, and the supraclavicular. Any pain or tenderness with those?
No.
I will begin assessing my patient's trachea and thyroid, noting that the trachea does fill midline, no deviation to either side. Assessing the thyroid, no fillings and abnormality there. Can you swallow for me, please? I feel the upward downward motion as noted. I will begin assessing my patient's carotid arteries. Present and normal. Present and normal filling and also matches the other. I will now assess or auscultate for any kind of bruise. Using the bell of my stethoscope, I didn't hear any kind of abnormal sounds. I will now assess my patient's range of motion. Can you touch your chin to your chest? Extend your head backwards. Turn to your right. And as the patient tries to turn their head back midline, I will apply a little resistance. She can overcome resistance. Turn to your left, please. She's still able to overcome resistance. I will also apply resistance as she tries to touch her right ear to her right shoulder. And the same with her left. The patient is able to overcome resistance in all areas. I will now assess my patient's posterior and lateral chest. Starting with a visual inspection, I see no breaks in the skin or any drainage. Everything appears to be as should be. I will palpate for tactile firmness by placing my hands upon the patient and asking them to repeat the phrase 99.
99. 99. 99. 99.
I feel vibrations throughout the patient's back all the way as should be. I will also check for symmetrical lateral expansion. Take a deep breath. And the chest expands symmetrically as it should. I will now percuss over all posterior lung fields. All sound appropriate as should be, and I will now assess the costrovertebral angle to assess for any kind of flank pain. Do you feel any tenderness?
No.
The patient has no tenderness in either area, and I will now assess the breath sounds in all lung fields. Deep breath. And I hear no adventitious breath sounds. I will now begin with the assessment of my patient's interior chest, begin with a visual inspection and also palpating for any abnormalities. I don't see any abnormalities, nor do I feel any. The breathing seems to be regular, unlabored, even on both sides. I'm not seeing any kind of evidence of thrills or heaves or PMI, nor am I seeing any kinds of pulsations throughout the patient's chest. I will now auscultate my patient's chest. Using the bell of my stethoscope, I will listen to the aortic area, the pulmonic. I can hear the S1 and S2, the tricuspid, and the mitral. I will now use the bell of my stethoscope to listen to all the same areas, beginning with the aortic, the pulmonic, S1 and S2 are audible, the tricuspid, and the pulmonic. Moving on to the assessment of the abdomen, I will now inspect the skin of my patient's abdomen. I see no breaks in the skin, no abnormal hair growth. I also notice that the abdomen is contoured, it's symmetric. I don't see any visible pulsations or any peristalsis. The umbilical is not herniated, and I don't see any other signs of herniations anywhere up on the abdomen. I'll listen to all 4 bowel sounds. bowel sounds are present, and now I will auscultate for renal arteries, making sure that there's no bruits. And there's no swishing or gurgling heard, or no swishing of the buoys heard. I will now percuss all four quadrants. All sounds are resonant as they're supposed to be. I will now lightly palpate all four quadrants. Any tenderness?
No.
The patient does not complain of any tenderness, nor is there any masses that can be felt. And I will deeply palpate all four quadrants as well. Still, no masses can be felt, and there is no complaints of tenderness from the patient. I will now try to palpate for a liver on the right side, of course. And the liver cannot be felt. I'm now assessing my patient's lower extremities while lying. Looking at the legs, I don't see any breaks in the skin, and both legs appear to be equal bilaterally. To assess the dorsalis pedis pulses, I'll palpate. Both are present bilaterally. I will assess the posterior tibial. Both are present. And to assess the popliteal pulses, both are present. I'll now ask my patient to raise each leg to a 90-degree angle, starting with the right. Okay. Now the left. The right knee to chest. Left knee to chest. Rotate your knees outward, inward. Bring your left leg outward and inward. And repeat the same with your right. Could you bring your left foot upward, down, right foot upward and down. Rotate your left foot outward and inward. Rotate your right foot outward and inward. Bring your left foot upward and bring your left foot downward. Right foot upward and right foot downward. Could you take your right heel and run it along your left shin and downward? And take your left heel and run it up and down your right shin. Looking at the patient's tibias, I notice no edema or swelling whatsoever. To assess my patient's reflexes, I'll begin with the patellar reflex. both are present and equal. To test the Achilles tendon, both are present. To assess the Babinski reflex, both are present. Assessing my patient's lower extremities while standing, I'll ask my patient to walk forward only on their heels. I'll now ask my patient to walk back to their original spot, walking only on their toes. Come forward a little. Hop on your right foot and hop on your left foot. I will now inspect and palpate my patient's spine. At first glance, it seems right in line, no curvature in it. Could you bend forward a little bit? The spine still seems erect and midline, no abnormal curvations to it or anything. I'm not feeling any kind of protrusions or anything abnormal with it. Turn to the side, please. Could you bend forward and touch your toes? Bend backwards. Bend from side to side. And also rotate your shoulders, please. I will now ask my patient to perform the Romberg test by keeping their hands down by their side and closing their eyes. I'm noting no side to side lateral movements. Now to assess my patient's upper extremities, I'll first inspect and palpate them. I'm not seeing any breaks in the skin, no scarring, no drainage noted. Hair seems to be evenly distributed, no spots or patches anywhere. I'll assess my patient's pulses bilaterally, starting with the brachial, present, the radial, present, ulnar, present, brachial on the right side, present, the radial on the right side, present, and the ulnar on the right side, present. I'm going to also assist capillary refill. Capillary refill is less than 2 seconds in all fingernails. Now I'm going to begin testing her range of motion. Starting with her hands, can you make a fist? Spread your fingers. Can you touch your fingers to your thumb? Correct. Bend your wrists and extend them. Can you rotate your wrist? Open your hand straight, make a fist again. Now, can you raise your hands above your head, out to the side, in front, down. Extend your arms behind you as far as possible. Thank you. Can you flex your arms and extend them? I will now ask my patient to extend her arms out to the side and touch her finger to her nose with each arm. I will now assess my patient's brachial reflex. Both are subtle but present. The tricep reflex. Relax your arm. And brachial. the bicep reflex. Both are subtle but present, the tricep and the bicep. I will now test my patient's graphthesia. Close your eyes, please, and tell me what number or letter I'm drawing in your hand.
F. Nine.
The patient passed both tests. Now we'll test her stereognosis. I'm going to ask her to close her eyes as I place items into her hand.
Safety pin. Coin. Battery. Coin. Safety pin. Battery.
As you can see, the patient can correctly identify objects placed in her hand.